that it would fall under the scope of what's called the ALCOA principles. And I want to take a bit through now what that means when we're looking at it specifically from patient interview perspective. The first part is that the patient interviews are being attributable. It means that we can go in and show who was it that conducted the interview. When did this patient interview take place? Who was the patient? Was it actually a correct patient, or was it someone that we just found on the street who came in and was a part of this interview? It needs to be attributable, the data that's actually being collected. The second part is then that it needs to be legible. This is where the recording that comes out for it is clear enough that it would faithfully produce an accurate representation of what happened during that interview. It's very simple to say that that's the best we can do, is just to make the recording from that. But when we then start taking that as a recording, that is where the real source data capture is coming. And if we then start transforming that into different formats, that's where it can be questionable if it's still a faithful representation of the original interview that took place. Contemporaneous is that the data we actually captured is also not reconstructed from notes. So what that would look like if we did it incorrectly, that would be that we have taken notes throughout the interview. And as a part of remembering what the notes are from that interview, that's how we are reconstructing the entire interview. That would not be good enough, because that would violate this principle. Again, coming back to the original recording. And that's exactly also the next thing, that it is the original recording. Because if we're doing it as a copy, there are rules to what that copy needs to live up to. That's where we are calling it a true copy. And producing a true copy of a voice recording is very difficult, because if you go from an audio recording into a text format, for example, how can you guarantee that you're producing all of the same small nuances that can happen in tonation, in how they said it, were they ironic when they said it, and so forth? That is a very difficult task to do when you're transforming it from one original recording into, for example, a transcript. It must also be accurate, and that's where the interview itself is also reflecting what is it that was actually said during the interview. If we are to treat the patient interviews as equal evidence on what the patients have experienced throughout a clinical trial, it needs to be accurate to what the patients have actually said. And the final thing here, which actually is a little bit outside of the ALCOA principles, is the complete picture. We need to have the full interview. If we are starting to remove parts of the interviews, selecting specific excerpts from the interview and so forth, we are violating the last very important principle here, and that is biasedly selecting elements that are supporting our evidence without keeping the complete interview picture.